All right. Well, without further ado, let me start. So, welcome to today's seminar in this sort of ongoing series. Today, we're focusing on how to measure research outcomes and impact. For those of you who don't know me, my name is Justin, and I work in with the Centre for Capacity Research here at the school. Okay. Oops, I'm saying as advertised. There we go. Sorry, I had a problem with my slide. As advertised, the objectives for today are around planning for outcomes and impact from the beginning of a project, the selection of indicators for your measuring outcome and impact, and how to show your project is on a trajectory to achieve impact. In thinking through how to present this content, or how best to present it, I've essentially settled on really framing this as an introduction to logic models and, to a lesser extent, theories of change. And I say lesser extent theories of change as I'm aware we've already had some seminars on that topic. So logic models and theories of change are approaches in which you would typically measure outcome and impact. So we'll talk through measuring outcome and impact largely within the context of logic models and theories of change, although with the emphasis on logic models, given we've already had some seminars on theories of change. So I'll briefly introduce those. I will present an example of a logic model based on something I've used in the past. And in giving that example, I guess the sort of intent is to highlight those factors or conditions that are highly favourable to using that approach to outcome and impact measurement, and conversely, those factors that kind of work against it or are less favourable. And recognising that logic model approach to outcome and impact measurement is not always ideal. We need to know when it's not ideal, and when you're faced with that, what are some of the solutions? So what might you do to either tailor or hone that logic model to better suit your needs, or indeed use a different approach entirely. I should also note that something strange has just happened there. Can you all see my presentation still?
Yeah. Yes.
So I no longer can. I don't know why. Sorry, I just need to fix this. Essentially, just to let you know what's going on, I was looking at my PowerPoint presentation, it suddenly disappeared, and now I'm looking at the regular Teams view. So what I might do, I don't know why that happened. So what I might do is just stop my screen share and then restart it. And while I do that, let me sort of continue. Okay, I'm sorted again. So where was I? So essentially these will be the three sections for today's talk: the introduction to logic models, the example, and some solutions to when logic models perhaps need to be rethought or something else used altogether. I think all in all, this will be about a 45-minute presentation, and hopefully there'll be a lot of time for discussion following that. I'd also like to note, although I have quite some experience in program evaluation and the use of, measuring outcome and impact of various projects, I suspect there's a lot of shared learning we could take from this group. So hopefully that will come to pass in the discussion that follows. At the end of my presentation, I'll also present what I consider some useful resources, which will hopefully be quite helpful to you. Let's move on and get into it. So measuring research outcome and impact, as I said, I really want to frame this at least as the default around using logic models and theories of change. So what is a logic model? I'm sure many of you are familiar with them, and essentially it looks something like this. And it is a model that is often required by funders, and it's a model that project managers and indeed PIs will often use as well. And the idea of a logic model is that it demonstrates in quite simple and linear form the pathway from your inputs, the things that you put into your respective projects, to the anticipated outcomes and impact from the work that you do. That's the idea of, that's why it's called a logic model. So there's quite a linear pathway from start to finish. In this slide, I really just attempt to explain the 5 different components of a logic model. I should also highlight that I'm really here talking about the use of a logic model in a non-experimental setting. So if we're conducting a health research project in the real world, so to speak, this certainly can apply to experimental studies, controlled trials and the like, although the discussion around that would be quite different to the discussion we're going to have this morning. So please bear that in mind. So let's look at the five components of a logic model. You start with your inputs. These are the resources that you have and indeed are needed to implement your proposed project. As I indicated earlier, I will give clear examples of all of these components in another slide or two. The second component are activities, the things that you will actually do with the available resources you have. The third component are the outputs, the tangible products, capacities or deliverables that will result from the activities. These 3 components are collectively known as process indicators. And pretty much, these are things that are directly under your control. Inputs are what you have, activities are what you do, outputs are the count or the record of what you do, if you like. In today's talk, we're focusing primarily on outcome and impact measures and indicators. Outcomes, this component of the logic model, are the changes that occur in people or conditions because of the activities and outputs. These are kind of the objectives, the goals that you have, the reasons why you're doing what you're doing. Impact, in simple terms, is really just a longer term, higher level outcome. They're not always described that way, but I think it's quite a simple way to understand the difference between outcome and impact. And this little box here tries to capture that as well. When we talk about outcome measures versus impact measures, our outcomes are usually things that we can measure in the short, possibly midterm, whereas impact measures generally are measured over a much longer term or a longer period of time. Similarly, when we talk about attribution, the extent to which you can claim your work has resulted in this outcome. When we look at short to midterm outcome measures, ideally you can more easily attribute those measures directly to the work you've done. When you start to look at longer term, higher level impacts, although your work will ideally have contributed to those impacts, it may not be so easy to directly attribute your work to it. So there is that sort of distinction between outcomes and impacts, but essentially they're all outcomes of some description or another. So that's a very simple introduction to a logic model. And that, just to briefly contrast that with theories of change. And on this slide, I'm presenting an example of a theory of change. And this example comes from our centre, the Centre for Capacity Research. So we have a theory of change about how we believe the work we do in our centre will have impact in the world. The thing to note about a theory of change in comparison to a logic model is that they generally have the same components. In a theory of change, you should also see that progression from kind of inputs and activities and outputs, your kind of process variables, to outcome and impact. The key difference between the two is that in a logic model, essentially it's quite a simplistic assumption that there is just a linear pathway from one to the other, and there's no real attempt to explain how that pathway occurs, how those changes may take place. Only that if you do A, then B will happen, C will happen, D, E, etc. In a theory of change, I guess it's somewhat more sophisticated. You still have those levels from inputs right through to impact, but there's some attempt to explain the causal pathway, and recognizing that the pathway is not always linear. So a theory of change is a bit more sophisticated, if you like, although the two are highly complementary and indeed are often used together. So a logic model example, and as I suggested earlier, this is a very simplistic portrayal of a logic model I've used in the past, and it comes from the Papua New Guinea National Malaria Control Program evaluation for the period 2008 through to 2017. And I'm presenting this because I led this evaluation, so I'm quite familiar with it. And this is not a full description of the logic model we used for this evaluation. It's a partial description, and it focuses primarily on the distribution of long-lasting insecticide-treated bed nets, which I'm sure many, if not all of you, are familiar with. So if we look at our 5 components of the logic model, the inputs for this project, simply put, are the LLINs, the bed nets themselves. So there's a large number of LLINs. There's the human resource needed to distribute these LLINs and the funding necessary to support that. The activity in this program was essentially countrywide mass distribution campaigns. So the bed nets are delivered across Papua New Guinea on a 3-yearly cycle. To give you some sense of scale, Papua New Guinea is about 8 million people across many islands, a main island and several smaller islands. So the inputs are what we have, the activities are what we do, the outputs are essentially a count of the number of bed nets delivered. So we had the bed nets, our activity was to distribute them. The output is basically how successful were we in doing that? Were we able to get the bed nets out to the community across the country as expected? So I think that's all straightforward, and those are your process indicators. And perhaps to just comment further, your output measures are typically counts. So it's we delivered 10 million mosquito nets, we delivered 5,000 training sessions, these sorts of things. And again, I'm sure many of you recognise measures of that type. The output and impact measures for this program, when we look at outcome, they really pertain to what happens to the bed nets once they're delivered, because obviously we want them to be used and we want them to be widely available. So some of the outcome measures there were the proportion of households with at least 2 bed nets within them available to residents, and the proportion of pregnant women who slept under a bed net the previous night. So there's no point delivering bed nets if we're not getting good coverage, because in order for this intervention to work, we need to know that all households are getting them and that all household members have access to them. And not only that they're getting them and have access to them, but they are indeed using them. So the outcome measures focus on that, the actual use of the intervention. The impact measures focus on what happens, or what we would expect to happen, if the bed nets are actually being used. If we've got them out, got them to all households, and all or most people are using them, then we would expect to see reductions in malaria parasite prevalence. So a measure there is the percentage of children aged between 16 to 59 months with malaria infection, annual parasite incidence, the number of malaria cases detected per 1,000 population per year. And because in the PNG setting, malaria is a major killer of children under 5, if this program is successful, ultimately we'd expect to see the all-cause mortality rate among children under 5 years of age decrease. So I think here you can see quite clearly the distinction between outcome measures and impact measures. The outcome measures can be captured in the short term. Once the nets have been delivered, what has our coverage been like? Are people using them? The impact measures are longer term measures that will result from the intervention being, successfully delivered and taken up by the population. So I think this serves as a really good example of a logic model in practice. And again, just to stress, this is just a partial glimpse of the logic model for this program. Now, some factors that make a logic model sensible to use in the context of the PNG program are as follows. Firstly, there was time. This program started in 2008 and in some form is continuing. So it's into its 13th year now. So you have that time to measure impact, because remember, impact measures require time. So if you're within the context of your project, you don't have that time, then it's a very difficult thing to try and measure. Secondly, there was money involved. So that this, as with many national malaria control programs, was supported by the Global Fund. I think over this time period, it was perhaps around 150 million US dollars. 10%, so 15 million, went to support the evaluation. So you can see there's a lot of time to do the evaluation and a lot of money available to support it. There's also the technical capacity to not only implement the program, but to support the evaluation of it, which was achieved through not just one talented individual, but through many individuals with a wide range of skills. Equally importantly, particularly when you're looking at outcome and impact measurement, in a malaria context, there is a wide bank of standardized, recognized outcome and impact indicators readily available. So all of these indicators listed here under outcome and impact, we didn't create. They already exist. They're endorsed by the World Health Organization, and they're widely used across malaria control programs around the world. So having those indicators readily available makes the job much easier, because we know they're proven, they do work, they are appropriate for this type of intervention, and they allow not only comparison within Papua New Guinea, but globally as well. So that's a real advantage to outcome and impact measurement in this case. Obviously, when you're reporting against outcome and impact measures, you need to be able to collect the data from somewhere. Parasite prevalence, incidence, all-cause mortality. In principle, these are things that a national health information system, or a robust national health information system, might be able to provide data for. In a PNG context, that's not true. The system is not robust enough. So the existing data sources were poor or quite weak, but because of the time available, because of the expertise available, and perhaps most importantly, because of the money available, we were able to get past that. We could develop a solution to those poor data sources. Equally important here is the objective, like the end goal, is quite clear and to do highly linear with the program activities. So that the logic being, if you provide bed nets across the country, if everybody uses them, then logically you would expect prevalence and incidence to decrease. And because malaria is such a major killer, you would expect a mortality rate to also decrease. So all of these outcome and impact measures make sense, and it can be directly, in this case, attributable to our intervention, because in this country context, there were no competing malaria interventions. So the only thing that was going on was this. So if there was some change, the only thing you could really, attribute it to is this particular activity. So for all of these reasons, employing a logic model structured in this way made great sense in a PNG context. Equally, for all of these reasons, if they're not met, it may not make sense to use a logic model, or to attempt to use a logic model to measure outcome and impact. And I might be repeating myself a little bit here, But just to emphasize the point, if the respective projects in which you're attempting to measure outcome impact are not long-term, then setting out with the goal of trying to measure longer-term impacts probably doesn't make any sense. So impact measurement in that case might not be possible, but that's not problematic. You just then focus on measuring short to mid-term outcomes, but you need to set that expectation from the outset. Similarly, some of these activities are expensive, and if you don't have that money available to you, you may not be able to operationalize them, even if it would be ideal to do so. Equally, if you don't have the technical capacity within your team to measure these sorts of things, why try and do it? Whilst in the malaria world, we're very privileged to have a large bank of standardized outcome and impact indicators. That is not true in all health research contexts. In fact, it's not true in most of them, I would suggest. So where you don't have standardized indicators available, it can complicate this process somewhat. Equally, when your objectives are not clear, when you're talking about very complex interventions where that pathway from your input and activities is perhaps not so direct in terms of your anticipated impact, this model may not be appropriate. Equally, if your project's quite small or there are many different interventions operating in the same space, the idea of looking for attribution may also not make sense. So these are all things that you need to consider at the outset of your study when you're thinking about your outcome and impact measurement approaches. So logic models work really well in some contexts, but not so well in others, depending on these factors. So having now introduced the logic model and theories of change to some extent, indicated where they can be useful and some of the factors you must consider, if you, at the start of a project and you've sort of thought through those factors we've just discussed, and you've decided, well, outcome and impact measurement in a classic logic model might be quite difficult, how might we overcome that? And what I'm going to present now, I guess, are three solutions, or three possible solutions. These are not the only three, there will be many more, but they are the three we're going to focus on today. The first, and that this may have been referred to in previous presentations, is the idea of using a nested theory of change. And the idea of a nested theory of change is that you're putting some distance between your particular project and the longer term impacts that you would hope your project contributes to. Why this is useful, and I think this is particularly useful when your project might be short term or particularly small in scale, or when the intervention space you're working in is particularly complex. So there's not necessarily a clear linear relationship between what you're doing and the high level impacts you hope to achieve. So that the sort of idea of a nested theory of change is that within your project or program theory of change, you're not articulating a detailed pathway from your sort of inputs and activities right through to those high level impacts. Rather, you're taking somewhat more of a modest view. So if we look at this graphic here, there are four ever larger circles, if you like. The smaller circle at the bottom would be your detailed theory of change, or indeed logic model, is that whilst you're hoping to contribute to social impact at that higher level, you recognise your project on its own is not going to do that or have minimal contribution to that, but that's what you are ultimately working towards. You can set your goals quite modestly, but you allude to the sort of intermediate pathway between your project and that social impact that you hope to achieve. I'm not entirely sure I'm explaining this as clearly as I could, but the logic being that in a logic model or a theory of change, you do need to provide some detail about what you're going to do and where you're going. So if you were to have a lower level nested theory of change or logic model, you would end with short to midterm outcome indicators that are closely connected to the work you're doing, but they might be relatively modest in scope. So that they wouldn't be, for example, measures of all-cause mortality or necessarily prevalence or incidence or things like this. Those are much larger social impact measures. But you allude to the fact that your piece of work, in combination with a bigger program or combinations of programs, start to contribute to that larger goal. So you provide the detail for what you're doing, you provide a clear pathway for how what you're doing will contribute to those bigger impacts, but you set the expectations at the right level. So hopefully that's clear, and there's indeed a reference there that talks about the nested theory of change approach in a bit more detail. A second solution is to employ qualitative measures of outcome, or impact, but really we're talking about outcome. In both logic models and theories of change, these are not methodologically specific, so that you can employ quantitative indicators, qualitative indicators, or a mix of the two. They're not designed for one or the other exclusively. So it's perfectly fine to use qualitative indicators, although in my experience, they're not utilised as often as perhaps they could be. And again, they're particularly suited to contexts where the interventions might be quite complex. The focus of your intervention might be quite intangible, so to speak, and something that's not necessarily easy to count or measure. Where funds are limited, qualitative indicators can perhaps be employed at lower cost. So there's many reasons for favouring a qualitative indicator. And I think increasingly funders recognise the value of qualitative indicators as well, in large part because it provides some life and depth to the work that they're funding. Just to be clear, the qualitative indicator, as I'm referring to here, is not numeric. So it shouldn't be something that's expressed as a number or that would be calculated by statistical methods. And the reason I'm saying this is when you refer to the literature around qualitative indicators, you're often directed to quantitative measures that quantitative measures of subjective topics. So a quantitative measure of a qualitative state, e.g. people's perceptions or judgments. I've given an example there, a 25% increase in reported satisfaction with the training provided. So satisfaction is a highly subjective concept. So this type of indicator might be described as qualitative because it is measuring something that is somewhat intangible. However, this is certainly not what we're referring to here. Rather, qualitative indicators, something that is expressed by words, pictures, or stories. And again, I've given an example there from the malaria program. So stories of the improvements in early line use that have occurred as a result of your project, with attached data being visual and or written. So photographs, videos, case studies of recipients of bed nets, that demonstrate the benefit of them having received one. The purpose of these types of indicators is to capture experience and to add depth or life to your reporting. Certainly they can be used as a complement to a quantitative measure. So you may have a count of something and you also want a qualitative measure to breathe life into that. But indeed, they can be an alternative. You can have purely qualitative outcome measures, no problem at all. Just the key thing to understand is that measurement in a qualitative sense is quite different to measurement within in a quantitative sense. And they're as sort of suggested, they're neither intrinsically better or worse than quantitative indicators. They're just better suited for some purposes in some contexts. In this slide, it sort of covers some of the types of qualitative indicators. And when we talk about this, what are we really talking about? Well, the data sources from which you might extract a qualitative indicator. Many of these will be familiar: interviews, group discussions, stories, photos, pictures, films, diaries, logs, observation, document reviews. All of these are legitimate data sources to inform a qualitative indicator. You may use one or many of these, could be cross-sectional or longitudinal. The analysis should be robust, but a qualitative indicator, or the use of qualitative indicators in evaluation, is not the same as qualitative research. And again, I think this is something that's a little misunderstood. So in research teams where you may not have qualitative researchers as a part of that team, there can be a reluctance to use these sorts of indicators through a fear of perhaps not having the necessary methodological expertise. But although you should be robust in how you collect and report such things, it doesn't necessarily have to be as in-depth or as exhaustive as what you might consider to be a qualitative research process. And quite diverse team members and stakeholders can contribute to the analysis of these types of data sources. So certainly research support staff, communications officers and the like can really get out there, take photos, write up good stories based on testimonials that speak to that photo, and this itself becomes quite a nice product, or a measure of what you're about. So that would be an example of a case study, vignettes, photo stories, short films, audio clips, testimonials. All of these things are legitimate forms of a qualitative outcome indicator. And as I've probably suggested a few times already, if you are struggling with time, if your intervention's particularly complex, if you don't have much funding, these can be great ways of demonstrating what your work is achieving. Sort of the final slide in this section, some considerations if you're choosing to use a qualitative outcome measure is how does it fit within your wider evaluation framework? Are you doing this as a complement to a quantitative indicator or as an alternative? I think being able to do both works really well, but in some cases you may only be able to do one or the other. Why are you doing it? Will it actually add value in the way that you plan to do it? Will it provide depth to your reporting or to your evaluation? Is it because what the outcomes that you expect to achieve are quite intangible and difficult to quantify, thereby your qualitative approach makes sense? What's the purpose here? And of course, just the practicalities. What type of qualitative data might it be possible to collect? When would you collect it? From where and who would do that? And again, the previous slide gave examples of what you might collect and what you might do with it. This is really thinking about who is going to do that and when are you going to get that data? And what resources do you have to not only support that collection, but also the reporting of it? And I think internally, research support staff in particular can be really valuable here, and I think are often an underused resource. Now, solution 3, as we've spoken to largely here about logic models and how to use one and perhaps how to overcome some of the difficulties of using a logic model, but there might be times when it just doesn't make sense to use one at all. And there are other approaches to measuring outcomes. The one I'm going to highlight here is participatory evaluation, where essentially you hand over the control to the study participants. So in terms of defining what it is you're actually planning to measure, like what are the relevant and important outcomes of your study, and how might you capture the data to measure or report that, I think the assumption is often, as researchers, we need to take that responsibility and work through that ourselves. But it's quite legitimate and increasingly valued to pass that control over to your study participants. And again, I think this works very well where your interventions are quite complex. They're working towards quite intangible goals, and where there really aren't reliable, recognised, standardised outcome and impact measures available. You know, when you're in that situation, as a researcher, then you're often faced with having to come up with that yourself in the early stages of a project, which can be fine, but why not pass that process over to the participants? Because, you know, they're the group you're working with. They're a group who, you know, if they believe this is an outcome of importance to them, then that's worthwhile measuring. And if it's coming from the stakeholder group themselves, then it's all the more powerful. So quite a different conceptual approach to outcome evaluation, and it certainly strays from a logic model, but there are many cases or contexts in which it would make sense to do this. So just to go through this slide, so participatory monitoring and evaluation is a process through which stakeholders at various levels engage in monitoring and evaluating your project. They share control over the content, not just in terms of designing what should be measured, but actually participating in the collection, analysis and reporting of that data as well. So how does this differ from conventional project evaluation? In conventional, you know, typically logic models, it's the experts who are measuring against those preset indicators. We're using standardized procedures and tools. In this participatory approach, it's your project stakeholders, you know, the participants themselves who are getting involved, evaluating. It's, you know, you're no longer carrying out the outcome evaluation, you're facilitating others to do that on your project's behalf, building their capacity and allowing that process to take place. As these sort of 4 steps indicate, it's quite important with participatory approaches, I think, that rather than work towards having robust or useful outcome data at the end of your project, that it is also sort of incorporated with a learning objective in mind, so that the outcomes in the earliest possible sense are available during the life course of a project in order to take corrective action. So I think that's the end of my key summary here. So in some, logic models and theory of change are perhaps the default approach to outcome and impact measurement. I think they're most commonly used, most commonly expected by funders. You know, in choosing to use one or another of these approaches, obviously these decisions need to be made at the earliest possible stage, you know, the outset of your project design, pre-implementation. And you want to focus on those factors I presented when I gave the example of the PNG malaria control program. You know, what are you in a context where the application of a linear logic model makes sense and is feasible, or are there challenges to that? Where there are challenges, as there often is, then I think 3 possible solutions are the use of nesting to scale back the expectations of what outcomes you will measure, but to demonstrate how they will connect to other projects, other programs and impacts over time. The use of qualitative indicators to capture intangible or quite complex outcomes that are not easy to measure, or indeed where you have limited time to measure such things, and where it makes sense to, I guess, set aside that linear logic model approach to outcome measurement altogether and perhaps employ participatory approaches. They're certainly a viable alternative. Some useful resources. I haven't gone too crazy here, but all of these are readily available online. The first one, I think, is a really simple and useful resource to or introduction to designs and methods in global health research, and there is a chapter there on outcome and impact measurement. The WHO has a list of 100 core health indicators. If you can use these to measure outcome and impact, you probably should, because they are tried, tested, proven measures that are widely used across the world. So it allows you to compare your work with the work that's gone before or in other contexts. So being familiar with those indicators is really helpful. The UK government has some guidance to logic models, believe it or not, which is quite a simple and accessible document. Recently, there's been a review of the value of theory of change as applied in UK development projects. That's a really useful resource there. And finally, there is a Centre for Theory of Change, which presents a lot of helpful examples and resources to building your own TOCs. So I'm going to stop there. This last slide is just an indication of the previous seminars in the series and the 2 to come. So keep those in mind, and just a further evaluation, reminder to look out for the evaluation.